So what's wrong with this x-ray? Obviously, there's lots of things wrong here, and we can point to many different details, but this unfortunate patient underwent a 2-level lumbar fusion. When we talk about lumbar fusion, the concept is to remove the disc, put implants in place, put some bone graft in the area so that the bone segments can fuse. If the bones don't fuse, there is some micromotion that continues to happen every time we move. It is just like a paperclip. When we keep bending that paperclip, the paperclip will eventually break. In this picture, we can see that there are implants that were placed where the disc was supposed to be. Pedicle screws were placed just to hold everything together. But since the bone didn't fuse, this screw eventually broke. Now, this seems to be a percutaneous placement of screws, and usually those percutaneous screws do not allow appropriate placement of bone graft. So we really rely on placing bone grafts in the front of the spine. But in this case, it did not fuse. It also resulted in degeneration of the adjacent level. This may or may not be related to the fusion surgery. This may be just progression of the arthritis that happened to the adjacent level, just like it happened in these 2 levels. But ultimately, when the fusion does not take place, it's called pseudoarthrosis. It is basically a fake type of a joint because it didn't fuse, and so scientifically we call it pseudoarthrosis. Sometimes it requires another operation, although not all the time. Sometimes just removing the screws allows the compression of the fusion site and eventually it fuses on its own. But overall, this is a relatively obvious case of hardware failure that was caused by pseudoarthrosis and failure of the fusion to take place.